Hey, good afternoon or morning for those of you that are on my side of the country. Welcome to ENA's Day Off the Hill. Today's advocacy and training event is the latest in ENA's continued efforts to deliver high quality programming for emergency nurses in a virtual platform. Today, as we go through this program, if you have any questions, feel free to use the Q&A tab at the bottom and ask your questions, and we'll try to respond to all your questions that you have kind of throughout the event. We have received strong feedback for our virtual symposium in April and the several virtual town halls and webinars held over the last few months. Emergency nurses are truly adaptable, and ENA is excited to be able to engage our members in new and innovative ways, even when we can't be together. Before we get into today's agenda, let me give you a quick shout out to the members of the ENA Board of Directors who have joined us today. As a whole, ENA has never worked harder on behalf of emergency nurses than it has this year. And the board is doing its part to stay connected to state leaders during a time when we all need to be talking about what nurses are seeing and experiencing on the front lines of this public health crisis. By now, I hope that each of you know about the ENA's continues to support nurses amid the COVID-19 pandemic. Since late January, the COVID-19 resource page on ENA's website has offered a plethora of clinical information, best practice guidance, self-care, and well-being supports, and much, much more to assist nurses in many different ways. The ENA's Foundations Grant Program has awarded 375 grants totaling near $275,000 to ENA members impacted by COVID-19. We encourage anyone seeking help to visit the Foundations page on the ENA's website to apply for a grant. If you're able to help others, visit enatogether.org to donate what you can to help support your colleagues and peers. As I mentioned a moment ago, mental health and well-being is a serious concern for nurses trying to cope on the professional and personal levels. The Nurses Together Connecting Through Conversations program is your avenue to talk with fellow nurses about what you're experiencing. These 1-hour calls available anytime can help you realize you're not alone during this trying time. Whether you realize it or not, your voice, the voice of emergency nurses, is always at the forefront of what ENA does. And that is most prominently happening in Washington, D.C., where our government relations team has stepped up to make sure Congress understands what you need to fulfill your commitment to care during this crisis. In the last 5 months, government relations has fought to, among other things, to ensure that you have enough PPE and for ED nurses to be in the line for hazard pay while treating COVID patients. They've collaborated with like-minded organizations to sign on to a series of letters to legislators that showed strong support for key COVID-related bills. The GR team secured a spot for ENA President-elect Ron Kraus in the White House for a meeting of nursing leaders with the president. And the government relations team has been the driving force behind mobilizing our EN 411 Action Network to rally for PPE by generating nearly 16,000 messages that reached every member of Congress. Advocacy is nothing new to ENA, but this public health crisis has shown just how strong our voice is in Washington, D.C. To guide us through the day off the Hill, let me introduce our government relations team, Director of Government Relations, Rob Kramer, to get us started, and ENA's Chief Government Relations Officer, Richard Moreau. Richard.
Okay, thank you everybody. Thank you, Mike, for that introduction. So I would like to join Mike in welcoming each of you to Day Off the Hill 2020. Although we were disappointed in having to cancel our planned Day on the Hill in April, I believe that we have packed a lot of important and very timely information into today's virtual event. I think it's safe to say for at least the next 3 or 4 months, most meetings with the House and Senate offices will be on Zoom or on the phone, although some offices are just beginning to hold live meetings in their home state or in their home district offices. As a result, while our program will focus on preparing you for virtual meetings, many of the skills you learned today will also be useful for in-person congressional meetings if they should resume. So I want to move right into the heart of our program, which is to review our legislative asks for Day Off the Hill. That these are the asks that you will be making in your upcoming virtual meetings. I'm going to be joining the session, as Mike mentioned, by Rod Kramer, ENA's Director of Government Relations. ENA will be going over the second bill on this list, which is the Medical Supply Transparency and Delivery Act. Well, I will be discussing the Effective Suicide Screening and Assessment in the Emergency Department Act. If you have any questions about either of these bills during this program, as Mike mentioned, please click on the Q&A button on the bottom of your screen, and we'll try to answer as many questions as you may have at the end of this presentation. So let's get right into our first legislative request, which is the Effective Suicide Screening and Assessment in the ED Act. This legislation is a great fit with our mission of advocating for excellence in emergency nursing practice, and it is perfectly in line with our public policy agenda, which calls for improving behavioral health care for emergency department patients. The other thing I wanted to note is that we have both a House and Senate version of this bill. The bills are exactly the same. So when you make your request in your upcoming meetings, very simply, the only difference is in the House, you'll be asking for co-sponsorship on HR 4861, and in the Senate, you'll be supporting S 3006. I also want to mention one other thing, and that's the bipartisan nature of these bills. In the House, our sponsor is Representative Gus Bilirakis, who is a Republican of Florida, and Representative Elliot Engel, a Democrat of New York. In the Senate, the lead is Senator Lisa Murkowski of Alaska, and she was joined by three original co-sponsors: Doug Jones of Alabama, Cory Gardner of Colorado, and Senator Angus King of Maine. Again, completely bipartisan support for this bill. This is important because, as you all know, in Washington, we have a divided government. The House is controlled by the Democratic Party. The Senate is Republican controlled. So for this bill, or any bill to have any chance to be passed into law, you need to have bipartisan support for the legislation. So let's get right into the one-page summary, which all of you should have received in an email several days ago. I would encourage all of you to share this document with congressional offices prior to your meetings. In this way, if the senator or representative will have the opportunity to study the bill, study the one-pager, and he'll be better prepared for when you do, in fact, meet. So I want to begin by talking about the upper left-hand portion of the one-pager. This section explains why this legislation is needed. And there's a lot of reasons why this legislation is very timely. We are in the midst, as everybody knows, of a suicide crisis in the United States. The top underlined portion brings out the fact that we've had a 31% increase in the suicide rate just since 2001. It accounts for 47,000 American fatalities each year. And this section makes two other points I just want to highlight real quickly. One is that a study done in 2016 has found that 11% of ED patients present with suicide ideation. However, only 3% were identified by screening. That really underlines the need for improving ED screening and treatment of people with suicide ideation. I think an even more important research finding is that figure that 70% of patients who leave the ED after a suicide attempt never attend their first outpatient appointment in the community. Again, that points to the need for this legislation, which addresses that issue. So the next section on the lower left-hand side of the one-pager focuses on the fact that the suicide crisis will only, unfortunately, get worse as a result of the coronavirus pandemic. This document makes several points. First, we know, unfortunately, from experience, that severe economic conditions leads to a greater number of suicides. This is borne out by the historical record. Back in 1932, at the very lowest point of the Great Depression, was also the year where the suicide rate was the highest in American history. In addition, with COVID-19, besides mass unemployment, you have social isolation, you have loneliness, you have reduced access to mental health. all these factors will worsen the suicide crisis. There's a lot of statistics that you can highlight in terms of the negative mental health impact, but just one that we mentioned here in this one pager is that a recent survey found that 45% of Americans have said that the pandemic has negatively affected their mental health. 19% of Americans said it has had a major negative impact. So we've gone over the need for the bill and why COVID-19 pandemic has actually made this bad problem even worse. This part of the bill on the right-hand side goes over the main provisions of the bill. It states right up front at the very top that HR 4861 S3006 will create a grant program established by the Department of Health and Human Services. The main point of the grant program is to assist emergency departments in developing protocols for identifying, assessing, and treating individuals who are at risk for suicide. But the grant program does more than just that. It provides training, additional training for ED personnel on high-risk patients. It establishes procedures and best practices with regard to coordination of care. This will help ensure that when patients are discharged, there is a warm handoff to ensure that they have appropriate follow-up care in the community. The money from the grants can be used to hire additional healthcare professionals, such as psychiatrists or psychologists, to help in the treatment of high-risk patients. And lastly, it improves access to care. Very important in this environment is the money can be used to improve telehealth services and other strategies to reduce boarding of patients in the emergency department. When these awards are granted, any hospital with an emergency department can apply. Preference is given to rural hospitals, as well as hospitals that are operated by the Indian Health Service or are run by Indian tribal organizations. That's reflective of Senator Murkowski's concern. She does a lot of work with tribal organizations of the unfortunately, very high suicide rate among the Native American population. And hospitals that are located in geographic areas with a higher than average suicide rate also can receive a preference in terms of receiving a grant. The other point here is that the funding level for this bill is capped at $20 million per year. That is not something you really need to mention in your meeting, but if you're asked a question, the appropriations for this bill, the funding level for this bill is up to $20 million a year. And the last point on the bottom is the fact that this bill is supported by many healthcare organizations. All the big behavioral health groups like National Association of Mental Illness, Mental Health America support this legislation. I think in total 50 organizations support it. ACEP supports this bill, as well as all the major suicide prevention groups are completely behind this bill. And that adds, I think that's an important point to make to senators and representatives. They want to be reassured that this bill has wide-ranging support. They do not want to go out on a limb and support a bill that doesn't have wide-ranging support. So I think mentioning all the groups, or at least some of the groups that are supportive of it, is very important. All right, and then on the lower right-hand side of the one-pager certainly is a very important part of it. During your meeting, everybody should get to the request, get to the ask. And as I mentioned earlier, we have a Senate version and a House version that are identical. So your requests that you will be making your meetings are identical except for the bill number. And our request is very straightforward. We're asking members of Congress to co-sponsor and support the bill, HR 4861 in the House and S3006 in the Senate. In terms of where we are now for co-sponsors, we have 9 co-sponsors for HR 4861. Elliot Engel, as I mentioned earlier, is an original co-sponsor. In the Senate, we have 3 co-sponsors, and all 3 are original co-sponsors. Original co-sponsors simply means that they signed onto the bill before it was even introduced. So they were supporters from the very inception of the legislation. If the member you're meeting with is already a co-sponsor, it really makes it easy. You start your meeting with a very heartfelt thank you to the member of Congress for co-sponsoring HR 4861 or S 3006. It's a great way to start the meeting, and then you can pivot to our other ask, which is the Medical Supply Transparency and Delivery Act. So you could start with the suicide bill and then move to HR 4861. And I think this is a good segue to Rob Kramer, who will now discuss the second legislative request, which is the medical supply bill. Rob?
So Richard, we did have a couple of quick questions for you on the suicide bill, if we want to take those before
Sure, I
we
can
turn it
take
over
them
to Rob.
now or later, whatever works best, Dan.
All right, well, let's go with a couple of them right now. First off, a question about any specific statistics related to pediatric suicide and its impact on the ED that has been discussed as part of this bill.
Dan, we didn't put any specific stats related to pediatric suicide. The suicide rate has unfortunately increased across all demographic groups, all age groups in the last 15, 20 years. We did not break out any specific demographic information, but we'd be happy if that ENA member has any questions regarding pediatric suicide. They can email me at my email, or they can email Rob Kramer at rob.kramer@ena.org or richard.moreau@ena.org, and we'd be happy to try to break out and give them some data on pediatric suicide.
Okay. A second question talks about suicide screening is already mandatory in this member state. However, they lack mental health services, so a warm handoff just doesn't exist. The question is, how will this bill help the outpatient service side?
The bill does not allocate money to outpatient services. That is being worked on in other legislation, which we are supporting. But what this bill does is at least make the transition, that warm handoff, occur by providing best practices and how to provide continuation of care. So it really improves things from the ED perspective, not from the outpatient perspective, but it does provide funding for continuation of care and the warm handoff idea.
Richard, last question right now would be, there's been some conversation most recently, Representative Engel and some others. This was discussed fairly recently. Can you talk a little bit about the action that came from that, or what some of the initial thoughts have been now that this is starting to slowly work its way into the process as things are starting to happen again on the Capitol?
Yeah, but we're pushing on many fronts. There was just a hearing in a very important House committee on the suicide bill. We are really gratified that that bill had a hearing. That's often the first step in the legislative process to try to get the bill passed through the House and Senate. So we're moving on two fronts. We're trying to move this bill as a standalone bill, trying to get a vote in the House and then a vote in the Senate. And we are pushing on all fronts to get co-sponsors to increase the likelihood that they will schedule a vote in the House and Senate. And that's where you all come in. We need more co-sponsors in both bodies, in both the House and the Senate. We're also working, Dan, to try to attach this bill to other legislation. And there's expected to be another COVID-19 bill that is winding its way through Congress. And that bill has many elements, including a mental health improvement element to it. And we are working very hard to make sure that 4861 is attached to that larger bill so it gets passed when that COVID-19 legislation gets enacted into law.
Well, very good. I think we're ready to hand it off to Rob to talk about PPE next.
Thanks, Dan. Thanks, Richard. Thanks, everybody, for joining us. I will remind everybody that if you have any questions, please use the Q&A function as part of your Zoom program. So what I'm going to talk about is the second legislative priority in our program, and it really goes to address a problem that I'm sure by now all of you are very intimately familiar with, and that is specifically for emergency nurses, really kind of narrowing in on inadequate amounts of protective personal equipment or personal protective equipment during the pandemic. So this is a topic on which ENA has been advocating heavily since the beginning of the outbreak. when it became clear that there was not going to be adequate stockpiles of this critical equipment to protect all of our workers from the SARS-CoV-2 virus. So the Medical Supply Transparency and Delivery Act is the bill that we're talking about. It was introduced in the House of Representatives as H.R. 6711 by Representative Jason Crow, a Democrat out of Colorado, and the Senate version was introduced by a good friend of ours, S. 3627, introduced by Senator Tammy Baldwin, a Democrat out of Wisconsin, who is also the sponsor of our workplace violence bill in the U.S. Senate. Unlike the suicide bill, this bill is not yet a bipartisan effort. It does have 62 co-sponsors in the House of Representatives. All of them are Democrats. And then S3627 has 47 co-sponsors in the U.S. Senate. 2 of them are independents, and the rest of them are Democrats. So much like the other one, we will walk through the bill using the sheet, the one-pager that we provided in the email from a couple of days ago. So we're going to build our argument and ultimately get to the ask for the bill, but we're going to start in this first section. It's intended to highlight really what PPE is for anybody that doesn't know by now, mainly Hill staffers, but it's pretty clear what we're talking about here when we talk about these things. But really kind of highlighting what PPE is and why it's important to emergency nurses. And I want to highlight that we're really talking about one real central strong theme here, and that is PPE, as we know it, is a critical yet often overlooked feature of the American healthcare system. And I think that's evidenced specifically by the shortage that we've been experiencing over the past 5 months or so. And the fact that we've really been in a shortage crisis situation since the beginning. Also, we want to highlight that without access to appropriate amounts of PPE, the lives of healthcare workers, including emergency nurses, as well as patients, people's families, people's communities, are ultimately at risk. And so here in this first section, we're really trying to just kind of hammer it home one last time for the staffers that are reviewing the sheet that PPE is critical, it's been forgotten, it's remembered now, and without access to appropriate amounts of it, people's lives are ultimately in danger. As we kind of move through the sheet here, of course, now we have an infographic that we can use, but really what we're talking about here is the deficiencies that have been exposed ultimately by the pandemic, really since the beginning. And once again, we highlight, from the earliest days of this crisis, healthcare sites, hospitals, nursing homes, outpatient clinics, we're all experiencing more or less immediate shortages of key medical supplies, specifically things like surgical masks, N95 masks, as you're all familiar with, gloves, gowns, face shields, all of these things I've learned about over the last 5 months as well. So it's been clear that from the very beginning, all these sites were experiencing shortages of this critical equipment. We also want to highlight that from the very earliest days of the outbreak in the U.S., that it was clear that there would not be anywhere near enough of basically everything that would be needed in order to protect workers from the outbreak or even provide for basic supplies in other areas as well. It became clear that, even testing supplies, the materials that were used to make tests were in short supply, and ultimately was going to hamper and did hamper the tracking of the virus as we moved through the pandemic as well. So it is also worth noting here that the federal response to the pandemic has at times been both confusing as well as disorganized, ultimately to the point where many states were forced to try to seek opportunities to obtain PPE on their own. They made these orders. Those orders were seized by the federal government and redirected to other areas, oftentimes with little explanation or reasoning. Ultimately, what we need here is, of course, a central authority to make sure that the needs are, that we're aware of what needs are out there and that those needs are going to be met. So as we continue to walk through our argument here, we really want to highlight that, in the meantime, while you guys have been out there caring for your communities and waiting for this PPE to arrive, you've really been forced to take a number of drastic measures and steps in order to keep yourself safe. You've used improper or expired equipment. You've made masks at home that you've been able to, or you've been forced to use while you're at work. We've heard of our members and nurses making gowns made out of trash bags. And we've also heard more or less that you all have been forced to reuse PPE over and over and over again, well past either its expiration date or past its normal recommended guidelines for its usage. And this is really something that we really cannot continue to allow to happen. So we've also noticed that since March, tens of billions of dollars through multiple pieces of federal legislation have been allocated for the purchase and delivery of this equipment. Yet still, when we talk to our members around the country, we still are seeing situations where you're not being able to use the equipment as it was designed or as it's been recommended by previous guidance in the CDC and as evidence would dictate. And this is really all continuing to sort of lay down the argument that we have suboptimal inventories of all this equipment and that these major problems continue to persist. Clearly, more can be done to ensure that the nation has what it needs, and that's where the legislation comes in. So, the Medical Transparency and Delivery Act, H.R. 6711 and S. 3627, would take a number of steps immediately to improve the acquisition, production, and delivery of supplies and equipment around the country. We've already established how important PPE is to emergency nurses. We've already established that the pandemic has immediately caused a shortage in critical supplies and equipment like PPE. We've already established that despite billions in investment, you continue to experience shortages at your work sites. And this all ultimately leads to the need, and it reveals cracks and deficiencies within our system that need to be addressed immediately. So what the bill would do is, first off, it would create an office at the very top of the federal government, the executive officer for critical medical equipment and supplies. And this office would oversee the production, the acquisition, as well as the distribution of equipment, supplies, including PPE, related to the COVID-19 pandemic. This is all supplies, all equipment. So it's not just PPE, it's not just testing supplies, it's also chairs, computers. It could be the acquisition of food for workers that are being called in to address the crisis as well. Anything that's being supplied by the federal government to address the crisis would come through this clearinghouse. In addition to being that central clearinghouse, this individual would receive requests for these supplies from states as well as other authorities like tribal governments, municipalities, and other authorities as well. They would make recommendations to the President of the United States on exercising the full authority of the Defense Production Act in order to ensure that these needs are met. It wouldn't provide them with the authority to implement the DPA, but it would require that they make recommendations to the President on how they can take those steps to make sure the country has what it needs. They would direct the distribution of all this critical equipment and supplies around the country in order to get it where it is most needed. One other interesting thing, or a couple other interesting things that are also included here, is as we move towards trying to get a more standardized system of testing out there and really trying to ramp up to where testing is not really a question anymore, this individual would contribute to supplying what is needed for that strategic national testing plan, as well as, and this is kind of the kicker here, if a vaccine is produced, they would also be heavily involved in addressing the production and the supply chain needs that are related to the distribution and the manufacture of that vaccine, which we all know is going to be especially critical to getting the country to full operation again. So really, what the bill more or less does is it creates a new position at the top of the federal government to oversee the acquisition, the production, and the delivery of all of the medical equipment, supplies that are going to be needed to deal with this particular pandemic. It doesn't extend beyond this pandemic, and there is language within the legislation that allows this individual to certify that all of the needs have been met, and thus signaling the beginning of the end of that position. Ultimately here, though, what we want you to do is go to your members of Congress, both in the House and the Senate, that have not already co-sponsored this legislation, and request that they co-sponsor and support the Medical Supply Transparency and Delivery Act of 2020. In the House, once again, this is H.R. 6711. In the Senate, it is S. 3627. It is something that we have supported and will continue to support. We ask that you guys get out there and meet with your members in these virtual settings and ask for them to support this legislation as well. I don't have a co-sponsor screen. As I mentioned before, we have, I believe it's 45 in the House of Representatives. Oh, no, sorry, 62 in the House of Representatives and 47 in the Senate. None of them are Republicans. Ultimately, what we need is some more GOP support on this bill. I would remind you, as you look at both the suicide screening bill as well as this legislation, if you are curious as to whether or not your senator or representative is a co-sponsor of the legislation, this is easy to find. You can go to www.congress.gov and you can look up the co-sponsor list as well as other information about the legislation via the HR or the S number, depending on the chamber. We also don't want you to forget that as you are working to schedule these virtual meetings, we would ask that you do coordinate with either your state government affairs chairperson or other designated lead in order to ensure that we're not doing multiple requests to the same office, and in order to ensure that we keep the volume of individuals on each call to a controlled level. After the event today, we will be sending a follow-up email that will include a meeting request template as we provided for Day on the Hill events in the past, as well as other opportunities to download the one-pagers and other useful information that can help you as you request these meetings and move through the rest of the summer. We do remind you that if you would, please download the one-pagers, and as you schedule these meetings or virtual interactions, that you would send them along ahead of time in order to allow the office to review both the one-pagers as well as support letters and other materials regarding the legislative priorities. And so with that, I think I can take some questions.
Definitely. Obviously, this is a key topic. So we'll start with sort of the maybe more of the inside baseball view from DC. We've got a couple of questions that are along the same theme here. So I'll give you a summary of these, and you can kind of answer them in one bundle. But one questioner points out, hey, we see some strong Democratic support on this. Another points out that there's some barriers that perhaps are coming from the other side. So the first part of the question would be, what are the barriers that are keeping this from getting the bipartisan support that this needs to really make an impact? And maybe in the larger spectrum, from the inside, we obviously know for our members that the impact and the need of PPE is really, really important. It's a much needed thing, but why is that not translating into materials showing up everywhere it needs to be? So you can take those in whichever order you want to, but that's sort of the inside baseball theme that a few of our first questions had.
Well, so to sort of frame it all, let me first acknowledge that this supply chain question is a gigantic issue, and it goes well beyond just what hospitals have arranged to keep in stock or have arranged for their own facility. It's more systemic in nature. It's much broader than one might normally imagine. It involves a number of different facets of the economy. So it's a very complicated issue. And in terms of what we can do right now to fix the problem, it really is more of an open question. In terms of what are the barriers to getting some additional support for the legislation, I would go back to the one pager and sort of highlight this section where we talked about the billions of dollars that have been invested. I think members that are reluctant on both sides of the aisle to join on to a piece of legislation like this that creates a new position in the upper echelons of the federal government is something some members might be a little uncomfortable with. They might be wanting to wait and see what can be done over the next couple of months to improve PPE access. From our perspective, we waited long enough. The problems persist in terms of, we don't necessarily hear about all the seizing of equipment, and some of the problems that we may have heard more about back in April and May. But certainly the volumes of PPE for our members, from what we're hearing, continue to remain low. And with the prospect of a spike in cases or a potential surge in the wintertime in the number of serious cases that might drive people to the ED or fill ICUs, I think a lot of people are sort of looking to that to see how that might go. In terms of barriers, I think that some of it comes down to it's the creation of the position. Some people might be opposed to that. Some might just want to be looking to see where the money's gonna affect the economy, at least at this moment.
So the sense that you get is that there's agreement that there's the need and the importance of
Absolutely.
Anybody on the front line has it. it's a matter of the logistics that maybe
It's a matter of, is this going to be the total solution? It doesn't have to be, in my opinion. From our position, it's a big piece of this puzzle and something that we think needs to be done immediately, because we're sort of really with the blinders on looking at our members, and we see members reusing equipment when they shouldn't be, and they're continuing to do so when we had 15,000 letters delivered back in March. So it's something that we're continuing to be concerned about.
So a counterpart to those questions earlier was also the idea of, if you're in one of your calls or a virtual meeting with a representative who offers some pushback on this, whether it be under the logistical side or what does this position really do, or maybe they don't see the inequity and where these supplies are going, any tips or tricks that you would suggest they bring up during that meeting to sort of counter any resistance that maybe is meant to diminish the importance or is more hung up on how this would operate procedurally as opposed to the importance of getting it into the hands of the people that need it?
I think from that perspective, really inviting them to come and see your facility. That's when you sort of open it up to them and say, okay, well, if you want to see what it's like to work in a facility where you have to reuse an N95 mask, for an entire week before you get a new one, and it's cleaned every night, and you really don't know if it's effective or not, then they can come and experience that with you. I think that it's a very difficult problem to overcome when you're talking about some of these ideological differences. I think when it comes down to it, ultimately, telling your story, stating your case, and making the argument for, we weren't coming to them telling them this needed to be done back in March, because it wasn't clear that this is something that was needed to be done. Now it's clear that we need a central authority. We need a better organization at the top of the federal government to coordinate all of these efforts. And right now it's just not being done.
So
it's an imperfect response, but I think it's one, continuing to let them know what it's like to live in your shoes at your facility is something that can be effective.
One other challenge that may come up, so each of our members that can go out and advocate for this, for the greater good, they may have some individual stories that they have not seen the same struggles with PPE. And as was pointed out by one commenter here, part of the reason why PPE was sort of taken in and overseen the way it was to prevent overstocking by some facilities, but there's been a little bit of course correction there. So the question, I guess, would be, if you have not lived through that and don't have that story, I would imagine that you're suggesting also that you can rely on the stories that are coming from all over, because each facility and each region and each ED has a little bit of a different story and experience. Doesn't mean that one is less worthy than another.
I think so, and our members would know better than me. I would say that if you're somebody who is in an area that has not really seen the crunch on PPE, my guess is it's probably related to a lower than what might otherwise be expected, serious case rate for the disease. So, we're seeing now that it's getting into more rural communities, more sort of suburban communities, especially as it sort of has swept across the South. Whereas back in the spring, of course, the big cities were the major hotspots. If you're in an area where it might not have been such a crisis, what I would say is, if it's not touching you now, it's going to. And if it's not this pandemic, it's going to be the next one. This is something that we have to look at as this is, people keep talking about the new normal. The prospect of global pandemics, I think you all would agree, is something that we have to do a better job to prepare for. And this is one step towards that,
So we got a couple minutes, so I got a couple more quick questions for you. One question that was submitted: will this position advocate for more U.S.-based manufacturing of PPE?
That's unclear. I think that as part of the overall intent here is to certainly shift some of our production capacity back to the domestic side of things, but that sort of ties into some of the complicated economic issues that we're talking about and things that we'll have to continue to kind of look at moving forward. But there's nothing within the bill that directly sort of makes that statement that, sort of mandating, domestic production.
All right, next question. With FEMA and state emergency representatives already in place, do we know if they are already addressing this issue, and do they have a plan? Basically, could duplication of efforts be part of the barrier for some of these things that you've talked about here?
It's possible, and I know that the FEMA has their state leads. They should be receiving, feedback from their local contacts as well. Ultimately, though, as it heads up the chain, one of the impetuses for this bill is that, as it gets to the top where we really need a central authority, delegation of this authority has been separated among, I think it's DOD, FEMA has shared it, DHS has had some of it too. So it's been multiple agencies with not really any of them really taking the lead, and then also entities within the White House sort of, pulling strings behind the scenes and making things happen. But ultimately, it's just contributing to confusion and disorganization.
So the last question is going to be a softball for you as a part of the government relations team. How important and how meaningful was it for our membership and our supporters to generate close to 15,000 messages on that action alert relating to PPE a few months ago? And what does that mean for this topic and this issue moving forward from your perspective?
So first off, it's incredibly effective, incredibly important, the volume of response. And I couldn't emphasize the word volume enough. I mean, I've been with ENA for about 4.5 years now. It's by far the largest action alert that we've had. It's the biggest response from our advocates to any single issue or bill or item that we've done since I've been here. And that says a lot, considering the fact that you guys, when I say you guys, I mean our members, considering the fact that, sort of our number one standing issue is workplace violence. And that's an issue that is so personal, and that always generates a huge response in our action alerts. This was just by and far leaps and bounds above that. I think, we're talking on the order of 20 times what we would have seen in a normal action alert, and that in a normal large action alert. It really does send a message to Congress, and not only the volume of messages, but also the coverage. I think when I looked at it last, we got messages to, I want to say, like 95% of members of Congress. So nearly every single member on Capitol Hill. And that says a lot. Saw this message, saw the concern that our members had for what they were going through. And this was, like I said, it was 4 months ago, and you're still going through it. So, and then I think I forgot the second part.
So basically, what does this do for ENA's voice moving forward when you get that sort of a volume out of one topic, and an important topic like this?
One thing that we, on the GR side of things, use the response rate on action alerts to gauge is the intensity of the viewpoints on these issues. So for me, it signaled, at least, immediately in that moment, this is the number one issue facing our members right now. This is the number one thing that they're concerned about with regards to this pandemic. It's the number one thing that I should be focused on, and that we should be looking at as a team to affect in terms of, improving things for our members. And as we move forward, it will continue to signal whether or not this is something that continues to be a major issue for our attendees, for our members moving forward. It's a good way to let us know that you care about an issue, is to participate.
We're now going to be moving to the final session of today's event. This is the part of the program where we will highlight some important points that you should be making in your congressional meeting, as well as some tips on a few things that you can even do better during your meeting. What we're going to do is first show a recording of a virtual congressional meeting involving members of the House of Representatives. The member will be played by Rob Kramer. For the purpose of this video, the congressman is a Republican from the state of Virginia. At various points during this meeting, we'll be stopping the video to focus on some key points. At the end of the meeting, we will answer questions. If you do have any questions, please submit them by clicking on the Q&A tab at the bottom of your screen. So with that, let's start the recording of our model congressional meeting.
Well, hi, how y'all doing? I'm Congressman Rob Kramer. It's good to see you guys. I think y'all are with the emergency nurses, is that correct?
That's correct. Hello, Congressman Kramer. So my name is Danita Mullins, and I'm an ER nurse. I work at Memorial Hospital in Richmond, Virginia. And I am a longtime constituent, and I am so excited to be meeting with you today.
Well, it's good to see you, Danita, and I love all the folks down there at Memorial. I've been down there a couple of times a year to see how everything's going, and you work in the ER there?
Yes, that's correct. I've worked there over 20 years.
That sounds like you have some activity going on today. I hope you don't get called away. Who else do we have on the call today?
Well, Hi, Congressman Kramer. My name's Amy Purcelli. I'm so thankful for your time. I know you're busy. I'm also an emergency room nurse. I'm a new constituent of yours. I've only been doing emergency nursing for a few years now. I just moved to Arlington, Virginia, and I work for MedStar, and I'm really proud to work for such a robust hospital system. So,
Oh, it's a big system and a great company. They employ a lot of folks down here in my district as well. And, I love the folks up there in Arlington too. But thank you both, Amy and Danita, for joining me today on the call. Tell me, kind of what's been going on with you guys in the pandemic and all. I mean, I know, we've had a lot of issues. I know that y'all have been really busy, especially in the early part of the pandemic, but kind of help me understand kind of what you guys have been going through.
So it has been actually still very, very busy. The pandemic is definitely still very, very active. And a lot of things have been going on that has affected us. A couple of the bills that we're going to talk to you about, specifically suicide screenings, and the other is about basically our lack of ability to get PPE or make sure that we are safe. So those are the main ones that we're talking about.
I thought it was a good place to stop because our two constituents, Danita and Amy, I thought did a great job in starting the meeting by introducing themselves, saying where they were from and which hospital they work at. That immediately establishes a tie to the district, a tie to the congressman. It makes that connection. These, as Brad said, members of Congress, whether senators, representatives, want to hear from voters, they want to hear from constituents. So establishing that connection up front should be an automatic in all your meetings. The other thing that I thought Danita did really well, after engaging in some small talk, which is obviously appropriate with Congressman Kramer, she immediately pivoted to the bills to keep the meeting going. So I just wanted to make those 2 points. Why don't we restart the video?
The first one we're going to talk about is HR 4861, the effective suicide screening and assessment in the emergency department. So this bill was introduced back in October of last year by Representative Gus Bilirakis and Elliot Engel, and it addresses the growing suicide crisis in our country. So I don't know if you know or not, but suicide is now the 10th leading cause of death, claiming more than 47,000 American lives each year. Since 2001, the suicide rate has risen sharply, increasing by 31% since that time. So as you can imagine, in the emergency department, we see this a lot. It's often the place that provides care for people with suicide risk factors, and a lot of times the emergency department is where these people come. They are not always admitted to the hospital, they are screened in the emergency department, and they are often sent out to the community. So we have people with serious mental illnesses, substance use disorders, but we know that we can do better. We know that there are suicidal patients that we may not be able to reach. So one study has shown while 11% of patients in the ER present with suicide ideation, only 3% were identified by screening, which is a really, really low number. So even more disturbing.
Please stop you there real quick for a second. Did you say 11%?
Yeah.
11% of people that come through the ED have some sort of suicidal ideation. That's what the research says.
Yes.
Wow. And the current screening's only catching how many?
3%.
3%. That is very low. Okay, I'm sorry to interrupt you. Please continue.
Yeah, no problem. So even more disturbing than that, up to 70% of participants who leave the ED after, or of patients who leave the ED after a suicide attempt never attend their first outpatient appointment. So while we think we may be doing really good, we send them like, hey, follow up with this number if you have any problems. They usually just don't do it. And
okay, I wanted to pause here because I think Danita does a really good job of introducing the bill. She talks about the bill name and the number. That's important. It's a House meeting, so she talks about HR 4861. Obviously, in a Senate meeting, you wouldn't be saying that. You would be talking about the S number. She also mentions the 2 sponsors of the bill, Representative Bilirakis and Representative Engel. That's important because that is a way that Danita is signaling to Congressman Kramer that it's a bipartisan bill. The Congressman will obviously know that Bilirakis is a Republican and Engel's a Democrat. So reinforcing that bipartisan nature is really a signal that whether you're a Democrat or Republican, you should consider supporting and co-sponsoring this bill. Other thing that I think Danita does really well is she uses data from the one-pager to reinforce the reason why we need the bill. She talks about 47,000 fatalities a year, a 31% increase. And then she explains why the emergency department is so important in terms of suicide screening. She mentions 11% of people have suicide ideation when they present to the ED, but only about 3% are properly identified. That again underlies the need for the legislation. And lastly, she talks about the 70% number that we've talked about before. 70% of patients who present after a suicide attempt do not attend their first outpatient appointment. So I think without getting overly technical, she does a good job of presenting some really important data to the congressman. Let's keep going.
So one of the things that we have noticed since the start of the pandemic, at least in my emergency department alone, is that our suicide patients have almost doubled since COVID-19. Economic factors, people are depressed, they can't get work, and they're stuck with their family a lot. So you have a lot of other comorbidities such as substance abuse, things like that. They can't get out, and you know that causes a stress on people and is causing more and more problems. The economic job losses and things like that. The CDC found that suicide rates reached a record high during the midst of the Great Depression. And we are seeing similar things during COVID-19. I mean, definitely seeing an increase. Yes, absolutely. We're definitely seeing a lot of increase of that. I had a patient just this last week who came in. He was 32 years old. He had a family of 4. And he was talking to me. He was wanting to commit suicide. He had already actually made an attempt. He had taken a lot of pills, and he just said, I can't do it anymore. And there's just too much in the world. And he's like, I cannot, the only way I'm going to be able to provide for my family is if my family can get my life insurance. And he was extremely, extremely depressed. And it's just really, really sad that you have situations like that. And he felt that there was no other way out. And in this particular case, we were able to screen him, and we were able to find him resources because he was very, very forthcoming. But we don't always have really good stories where they're able to open up like that. So it can be very, very challenging.
All right, in this segment, I think Danita did a great job once again. She previously talked about facts and figures, but in this 2-minute segment, she talked about her personal experience. She talked about her hospital. Remember, this hospital is in the congressman's district, and the fact that they've seen a 100% increase in patients who present with suicide ideation. That's a really important fact to bring out to the member of Congress. And then she tells the story very appropriately, and I thought very powerfully, of the 32-year-old in her ED who was suicidal and how she tried to treat that patient. Going back to what Brad said in the last segment, the power of storytelling, the power of personalizing her message to her situation. I thought she did a great job in talking about that. I think it made a real impact on the congressman. Let's keep going, Rob.
So in response to the growing suicide crisis, the bill we're supporting, HR 4861, would improve the capability of hospital emergency departments to identify and treat high-risk patients. I'm sorry, our ER just got a little bit busy, so I apologize for the background.
Well, it's okay. And if you need to run, let me know. It's just fine. I understand y'all have responsibilities, and I appreciate you taking the time.
Yeah, no problem. It just got a little bit busy today. It's a Monday. So in response to this growing suicide crisis, HR 4861 would improve capability of hospital emergency departments to identify and treat high-risk patients. Specifically, it would create a grant program established by the Department of Health and Human Services to assist EDs in developing protocols to screen and assess individuals who are at risk for suicide. So these type of grants could be used to train healthcare providers on better identifying and treating patients. They could also be used to hire additional healthcare professionals, including behavioral health specialists, to treat patients at risk. Not all emergency departments have this resource. Not all hospitals have a psychiatric. My particular hospital, those patients have to sit in the emergency department for sometimes days at a time to be transferred to another facility that does. If we had behavioral health specialists immediately available, sometimes they could be treated right there, and that could, you know, overall make an additional resource so we can see more patients in the emergency department.
Okay, I wanted to pause there because this is where Danita gets into the provisions of the bill, the heart of the bill, and she makes some really good points from the one-pager, some description of the bill, but she doesn't overdo it. She does not explain every single element, which in the interest of time, you really don't have time to go through every element of the bill, but she talks about the highlights of the bill. She also brings it back to her own ED and says they simply don't have enough personnel or resources to handle the mental health crisis. And she talks about how this bill provides funding to hire additional mental health specialists. So again, she identifies the problem in her hospital and talks about how the bill can help alleviate that problem, which I thought was really a very well said reason to support the bill. The other thing that I found interesting was Danita got interrupted by the noise of her emergency department. I think that actually adds to the authenticity of what she's saying. It conveys that she works in a very busy environment, and I don't think that in any way detracted from her message to the congressman. All right, Rob, let's keep going.
Okay,
We could
quick
also
question. Can I ask a quick question to Danita? When typically right now, what kind of happens when somebody comes to the ED and you suspect they might have are these people coming with mental health issues, or are they coming with underlying physical issues and then you're discovering their mental health issues otherwise?
all of the above, honestly. A lot of them have mental health issues. A lot of them have a lot of chronic conditions, such as dialysis patients or people with a lot of, morbid obesity. So then you have multiple other factors in there. And on the back side of that, then they have depression. So there's a lot of different factors. It's not just one thing. And that's why it's really important to develop screening so that you can find all of those underlying, other problems.
So the bill really takes aim at improving the screening of these individuals when they get to the ED.
Yes, absolutely.
Understood.
Yeah, I mean, because we do get those patients that come in and that completely say, I'm suicidal, I want to kill myself. But majority of the time, it's the other slight things that we don't catch up on.
Right. Okay. Would the bill do anything else? Yep, I'm sorry, go ahead.
Yeah, no, go ahead. So the last thing is they can also be used to establish telehealth services for treating high-risk patients. So in my particular ER, this would really, really help because we don't have a psychiatrist to come in. And so if we were able to get someone via telehealth to come and evaluate that patient and recommend somewhere immediately they can go so we don't have to wait for those services from something else, then this would be really, really helpful. So this bill actually has wide-ranging support, including the support of 50 healthcare organizations, including many of the major mental health organizations in the U.S. So a lot of support for this bill. I also have a letter I can share with you from a coalition of 50 mental health groups expressing their support for specifically HR 4861.
Oh, sure, yeah, send that along, please.
Yes, absolutely.
And then you say the bill is HR 4861?
Yes.
Okay.
So this is really, really important for our patients. It's really, really important for our emergency room staff. And we really would greatly appreciate your support, and especially if you'd agree to co-sponsor this important bipartisan bill. So this already has a lot of support, but we really, really would appreciate your support.
Well, I certainly this is something that I wasn't aware of previously. I didn't realize that the suicide issue had really kind of hit such a tipping point in this country. And clearly with the pandemic and all the problem that it creates, there are clearly economic factors here, social isolation and emotional factors that are at play here. And I wouldn't be surprised at all if our rates are going to spike because of this problem. So seems like a novel solution. It really seems like you guys as emergency nurses are trying to get behind the problem and trying to make a difference where you can. So it's certainly something I want to take a look at. So I'll definitely take a look at that bill. I appreciate you bringing it to me.
All right, so this part of the meeting where Danita's speaking is coming to an end, and I thought she did a great job closing. She, I think, did two things that I wanted to highlight. One, she talked about the widespread support for the bill. Again, as I said earlier, that really gives the Congressman reassurance that a lot of different groups are behind this bill, including a lot of major mental health organizations. I think that really gives credibility to the legislation. And the other thing that I think Danita did really well at the end was she got to the request and she said, we need you to co-sponsor this bill. And then she repeated that a couple of times. She really tried to be very strong in getting the congressman to commit to being a co-sponsor. He actually didn't commit. He sounded like he was supportive, but did not commit to being a co-sponsor. So maybe one thing that we could do, we could have done a little differently, is Danita could have said, who can I follow up with in your office? Because there's an opening. If he didn't commit to being a co-sponsor, you may want to send additional information to that office. As Brad said, that's really important to send the one-pager electronically. So it is absolutely appropriate for Danita to ask, hey, who should I talk to in your office? Who can I send information to? But she did a great job in highlighting the key aspects of the bill and, very importantly, making sure she got to the request for co-sponsorship at the very end of her part of the meeting. So now I think we're going to restart and go to our second request.
Yes.
What else would you like to talk about today?
So Congressman Kramer, our second ask is I want to talk to you about something really important that we desperately need as emergency nurses to do our job and protect our patients and their families as well. And that's the Medical Supply Transparency and Delivery Act. This is HR 6711. It was introduced by Jason Crow out of Colorado. This act is really important because it's going to address, I'm sure, the problems that you have heard of, the mass shortages of the PPE or the protective equipment that we need to do our jobs. There's been critical shortages of these supplies all across the country. Especially the number one issue is there's a lack of a clear central authority and guidance on the national level on our response to the coronavirus pandemic. Number one, this lack of a clear central authority has led to, there's been diversion of resources. I know our hospital, such a huge, robust system, we had supplies coming. They got diverted to a different state. We couldn't even call to ask somebody, which state, where did they go, why? And, you know, I'm stuck using the same mask for a week, you know, that, I mean, would you want me to treat your mother or yourself with a mask that I treated someone who had coronavirus with because we're short? We don't know what the effects of that are because we don't know enough about this pandemic, but I don't want to do that to my patients, and I don't feel safe doing my job. 80% of emergency room nurses have been surveyed that they're not using these N95 masks to the appropriate level. You're supposed to use it once, throw it away with each patient contact every time. So instead, that's what the CDC used to say. Now I'm being told I can reuse it, and that doesn't make me feel safe. 60% of emergency nurses surveyed also agree that they don't feel safe doing this. So we just want to be able to do our job and do it safely.
All right, at this point, I thought Amy did a great job getting right into what the bill does. She again mentions the bill number and who the sponsor is, gives the overview of the bill in a very concise way. I thought she did a great job introducing the bill. And then she made it personal. Again, she talked about her own situation in her own emergency department, and she asked that rhetorical question, would you want me to treat your family member with the same mask I used to treat a coronavirus patient. I think that's a really powerful way to frame the issue to the congressman. And then she goes on and highlights some survey data from the one pager. Again, she doesn't overdo it, but I think she mentions that 80% of emergency nurses are not using the N95 mask to the appropriate level. Again, that gives further support to her contention that we need this bill. So let's restart and keep going with this bill here.
So what this bill is going to do is help create, it's going to create a high-level federal position called the Executive Officer of Critical Medical Supplies. And it's going to oversee all these medical supplies. Like it's not only just N95s, right? We need goggles, gowns, gloves, other regular surgical masks, face shields. It's a whole getup we have to do, you know? Where are we going to get that stuff? And this has been a problem for almost 6 months now, and we're still on the front end of it. So we need somebody to go to answer our questions, to keep us safe so we can do our job. So hopefully this executive officer of supplies would be the #1 person we can go to. This also, since it's a high-level federal position, is going to help advise the president when and if we need to enact the Defense Production Act, which is, I mean, that's a huge call. So there needs to be somebody who is diligent and educated enough and knowing what we need at the front lines in order to make the decision to give us what we need and when we need it.
Let me ask you a couple of questions if I can about the PPE thing is something that we've heard a lot about up here in Congress, something that we've had a lot of concern about. Have you ever in the past 4 months been able to use PPE the way that you're supposed to?
I really wish, Congressman, that I could say yes, but the answer is no.
Not even now, after we've spent billions, tens of billions of dollars. I mean, I kind of was under the impression that this had been improving somewhat over the past couple of months, but you're telling me that it's not.
No, unfortunately, the supply chain is still extremely unreliable. Like, we don't know if they're coming, when. We're just lucky enough to actually be, like last week, we actually had a donation from a construction company of N95s. And if we didn't have that donation, I personally wouldn't have had the mask that I need because I have a smaller face. So I have to wear a specific kind of N95 that protects me. And there's only one size. And if they're out, they're out. So last week we ran out and I had to use the incorrect size. So for 12 hours in the emergency department, I don't know who's positive, who's not. I'm not protected. And yet I do my job and I still did it. So I don't want anybody else, my other colleagues, to have to put themselves at risk. So if there's something simple we can do, like sign this bill to help protect not just me, but everybody else in this country that's trying to do their job, I think this is a simple thing that you can do to help us.
All right, I thought Amy did a great job in first going over the main reason behind the bill, which is the need for a central supply chain coordinator. She reiterated that point and made it very strongly. And then she talked about her own personal experience, and she told really 2 excellent stories. One was the donation from the construction company, which speaks volumes, that a construction company had to supply a hospital in the congressman's district with extra N95 masks. That just speaks volumes about the problem and the need for this legislation. And then she also personalized by talking about her own struggles with getting an N95 mask that fit her face. So I thought she did a really, really good job in talking about the big picture of the bill and then talking about her own experiences in her own emergency department. Let's proceed.
Well, let me first start out by saying that I fully support you guys in getting the equipment that you so desperately need. It is truly a catastrophe that we've seen in terms of the amount of supplies that were available for you guys from the beginning. You know, Virginia, we've seen our own problems, as you all have mentioned, highlighted very clearly about, you know, the availability of these supplies as well. My concern mainly is, this sounds a lot like creating the other people have been talking about a PPE czar. Sounds a lot like that. I'm just not, from my perspective, I'm not sure if creating another federal position is really what's necessary here. I think we kind of need to take a look at all the money that we've invested in this up until this point and see where we might be able to affect, some changes down the road and encourage more private partnerships locally and local, with local partners to make sure that PPE is available in the future. This is something that I definitely want to take a look at in terms of the legislation that you all proposed. What's the number on that bill again, Amy?
So this is HR 6711. 67.
HR 6711.
Yeah.
Okay. Is this something I'll have to take a look at? I certainly want to do everything I can to make sure that you guys are getting the support that you need and the PPE that you need. I recognize that these masks are critical to not only helping you guys, but also taking care of your patients as well as those of us out in the community. So we appreciate all the really untenable sacrifices that you guys have made to keep your community safe. So we thank you for that. This is just something I'm going to have to take a closer look at. We kind of been under the impression that all the money had really kind of helped alleviate the problem. So this is something that we'll continue to look at. But I'll take a look at both this one as well as HR 4861 or 4681. So I really appreciate you guys taking the time to meet with me today. I appreciate all the work that you guys are doing in your communities to keep your patients safe, keep me and my family safe, and all of our constituents and all of your neighbors. So just thank you guys for the work that you're doing, and just let us know if there's anything else that we can continue to help with in the future. But let me ask a quick question real quick. Do you know what kind of supplies are going to be needed as we move into the fall? Is it going to be different types of equipment? Is it the same types of equipment that we need now? And how much of it? Is that something that you guys have a sense of in terms of how much that you're going to need?
So this is actually a great question for the person that this bill would put into place. It's really hard to give a number for what we're going to need because area of the country is different. And I think that's why it's so important to have a point person that can coordinate the Midwest with the Northeast, the South. Everybody's needs are different, but we're all doing the same job. So there needs to be one point person that can help crunch those numbers to tell you in Congress, we need XYZ here. We need this amount contributed to that. And especially since you mentioned the future, what's really important about this bill that I didn't mention is that this PPE czar, I like that term that you said, this person would actually help establish a vaccine response plan, which, as you and I both know, is probably the most important thing that we need to get forward and move on.
Yep, it's going to be critical.
Yeah, so and the issue with the vaccine is we don't want to run into the same issue that we had with the testing, that we didn't have enough distributed to every part of the country, to every American who needed it. So we don't want that same issue with the vaccine. We want to make sure that everybody in this country can get that vaccine if they need it, which we're all going to. So this person would be able to get the job done.
Understood. I'm sorry, guys. I'm running a little short on time. I got to head off to another meeting. I want to let you guys get back to your important work that you're doing there down in your communities in Arlington and in Richmond. But thank you so much for taking the time to meet with me today. I'll certainly give your request a good look over, see if we can't co-sponsor one of these bills. But y'all stay safe in your communities, be well, and thank you for all the work that you're doing.
Thank you so much.
Thank you.
Thank y'all. We'll talk to you soon.
Okay, in this last part, I thought that Amy did a great job in responding to the congressman who asked kind of an impossible question, which is how many supplies, what type of supplies will be needed. And she turned it back to the reason we're doing this bill, which is to have a central focus coordinator who can coordinate all medical and PPE supplies for the whole country. So I thought she really brought it back to the essence of the bill. And one thing that I would have done a little differently than Amy did is I would have been more direct in asking for co-sponsorship. She did ask at one point, will you support the bill? But I would be very direct and say, Congressman, we need your support. We need your co-sponsorship on this bill. But overall, I thought both Danita and Amy did an excellent job. They were clearly in command of the facts and what the bills do. They conveyed the key information. Importantly, they both were really strong in telling stories and their own personal experiences, which really helped support the bill. I thought it was really, made an emotional impact on the congressman. And at the end, they both got to the ask, they got to the request. So I think they just did a wonderful job, and they hit all the main points that you want to do in a virtual meeting or in an in-person meeting. Many of the elements of success are the same, whether you're doing it on the phone or on Zoom or in somebody's office. So just want to say thank you to both of them for volunteering to do that, and they did a great job in modeling what a good virtual meeting looks like. And now I think I'm going to turn it over to Dan Campana for some questions that people may have.
Well, Richard, you guys did such a good job. All you have are compliments. Very few questions about the training aspect there. One of the comments focuses very specifically, says, thank you for demonstrating how these virtual meetings can still be effective. So, there's one positive. Another was, the role play session was extremely helpful. So, kudos to you and Rob for, and for the participants there to show that although we're in a different world, the same dynamics that you guys have shown in person Day on the Hill certainly still work in this virtual format. And a lot of the things that Brad also talked about for storytelling and getting the points across, obviously that's resonated with everybody here today. We do have one question that is sort of more general. So I'll throw this at you, and I know that you have a special introduction you want to do right after this. So the one other question that came in that is sort of overall on the advocacy side is, do you have any tips for simple ways to understand a legislator's record of how they voted on certain issues and how their ideologies may be tied into how they voted? So they ask whether it's about visiting trackbill.com or doing other things to build relationships and understand what their voting patterns might be like.
Yeah, there's a couple of ways of doing it. One is you look to their website. The website will give you information on what they're supportive of more than what they're against, but it gives you a good indication of their priorities and what really motivates them and what issues they're involved in. The other way is to go to congress.gov. You can type in any bill that you want to look up, and they will give you the history of that bill, including any votes. And if you click on the actual vote in favor or against the bill, they'll give you a list of every member of Congress and how they voted. So if you want to know how they voted on the suicide bill, when that comes up for the vote, you would type in HR 4861 in congress.gov, and it will provide a listing of how every member of Congress voted. So that's probably the best way, the easiest way to get their record on issue, the website, and look at their voting record on congress.gov.
Well, very good. Richard, I know you have an introduction that you'd like to make here as we wrap up these last few minutes.
Thank you, Dan. I just want to, first of all, express my appreciation for everybody's willingness to be here with us today, especially in the middle of this pandemic. Again, if you have any questions about today's program or on the two legislative priorities, please email Rob and me at gov@ena.org. That's gov@ena.org. Again, thank you for all your work on behalf of all our government relations activities. Now, at this time, I want to turn it over to ENA's Chief Executive Officer, Nancy McCray, for some closing comments. Nancy?
Well, hello, everybody. Thank you, Richard, very much. Really appreciated the opportunity to sit on this, and really just wanted to take a minute to close it out by thanking all of you personally for participating in this virtual advocacy event. For me, and I know I speak on behalf of all the staff, we continue to be so inspired by your passion for what you do and your commitment to continually trying to improve the environment of care and the patient care and the patient outcomes for the patients you serve. So from all of us, we thank you for your passion and your commitment. As we know, these are certainly unprecedented times, and COVID-19 has certainly changed many things in our world, including how ENA continues to engage with our members. This format, as I hope you all enjoyed, we continue to learn about how we can engage virtually and continue the important work and support the firsthand frontline work that you all are doing. The new reality is certainly reflected in the legislative priorities that we are advocating on the Hill, and that you all, as a result of the training today and your ongoing efforts to learn more about how you can be an advocate for your patients and your profession, will make a meaningful difference in how we can improve our care. So as we heard from Brad today, I want to remind you, you have a compelling story to tell, and our legislators want to hear from you. You must be heard now. So thank you for taking the time to learn more about how you can be an effective advocate, taking the time out of your busy schedule, and thank you for all you do on behalf of ENA. Richard?
Thank you, Nancy. And I think with that, we're going to close out our virtual Day Off the Hill session. Thank you again for your participation. Thanks very much for being with us today.